Good evening, esteemed members of the Pharmaceutical Society of Kenya. Good evening, senior respected members who are joining us this wonderful evening. I can see Dr. Irongo is here with us. Welcome so very much. Today's webinar is in partnership with USAID MTAPS program, and it is on the role of the pharmacist in the wake of emerging and re-emerging infections. We're going to begin this meeting once we get to a number 200 or 7:05 p.m. So just to get to know who are joining us tonight, kindly write where you're joining us from and probably your area of practice, so that our speakers for today can be able to understand who they are able to interact with. Just let us know where you're joining us from and your area of practice. Thank you so very much and welcome to today's meeting. Thank you so very much, Dr. Gurusharadjan from Saji from Mombasa. Welcome to today's meeting. Thank you so very much. That is now a distributor. So let us interact and get to know where you're joining us from. Wonderful Dr. Seema Shah, antimicrobial clinical pharmacist from Mombasa. Dr. John Maura, a community in community practice in Nairobi. Wonderful, Dr. Diana Karaoke, that is AAR Hospital. Thank you so very much, Dr. Karibu sana to today's meeting. Let us know, for those who are joining us, we're going to begin at exactly 7:05, or the closest we get to 200 attendees, either or, whichever comes first. So in the meantime, we're just on the chat box. We're just interacting and getting to know where we are practicing, so that we are able to see our speakers for today, able to see who they are interacting with. I can see Dr. Peter Karegwa from Tigoni Hospital, and also Dr. Neto, clinical pharmacist from Kisumu. Karibuni sana, senior. Dr. Omurwa Edwin from Nairobi Hospital. Karibu sana. Dr. Sylvia Maveke, Mbeere District Hospital. Karibu sana. All the way from Holland, Mokano Frederick, Karibu sana. Dr. Mika Anyona from Jipiego, Kenya. Welcome so very much. Mr. Peter Maina from Mudhua Hospital in Odhiru. Dr. Wanjala Elderholt, Pharmaceuticals, Mombasa. Dr. Mageto, Jack's Pharmacy in Kisii, Community Pharmacy. Once again, welcome so very much our esteemed attendees, dear respected seniors of the Pharmaceutical Society of Kenya, members of the Pharmaceutical Society of Kenya, and the honorable fellows who may have joined us of the Pharmaceutical Society of Kenya, and other allied healthcare professionals who are joining us today. Welcome to our meeting today. Our meeting is in partnership with USAID MTAPS program. It is on the role of the pharmacist in the wake of emerging and re-emerging infections. What we are doing before we get to 200 attendees, or before we get to 7:05, I'm requesting you to write on the chat box just where you're joining us from and where do you practice. Thank you so very much. Nasra Abdillahi from Safa Pharmaceuticals Limited, Nairobi. Dr. Anderson Chebron, Kabarak University. Thank you so very much, Dr. Masharia Kamande from Taita Taveta County. It's already 7:04, 1 more minute before we get to begin our meeting. And I can see Ruth Muse from Allium Pharmacy Nairobi, that's community pharmacy. Dr. Joseph from Bugurani, karibuni sana to today's meeting. Our meeting today is in partnership with USAID MTAPS program, and it's a meeting basically on the role of all the pharmacists in the wake of emerging and re-emerging infections. Dr. Edna Kubai from Nanyuki Referral Hospital, welcome so very much, Dr. to today's meeting. Dr. Marion Gatuda from Kirinyaga County, clinical pharmacist. Karibu sana, Daktari. It's our pleasure hosting you. Without further much ado, as I had promised, we'll begin at 7:05, and the time is now. Once again, I do wish to welcome you, esteemed members of the Pharmaceutical Society of Kenya, senior respected members of the Pharmaceutical Society of Kenya. I can see Dr. Ajay Patel is here with us. Karibu sana, Daktari. Also, the clinical pharmacists who are joining us, other allied healthcare professionals, and the honorable fellows who may have joined us tonight and on this wonderful evening. Welcome so very much to today's webinar. Today's webinar is in collaboration with USAID MTAPS program, and it's on the role of the pharmacist in the wake of emerging and re-emerging infections. I'll just go directly and go to a few homegrown rules. Just before I get to the homegrown rules, there's something I want to share with us as we are able to go through it as I read the home rules kidogo. So on the chat box, first and foremost, I want to welcome you to today's webinar. And I also want to request you to fill in the survey below. It's on the pharmaceutical quality assurance and regulation in the country and the way forward in terms of how best we are trained as pharmacists in the country. Kindly take your time to fill in that survey as I go through the introductions slideshow. A few ground rules and announcements. First and foremost, thank you so very much for participating in this session. All participants are muted during the entire course of this session. I will request you to ask the questions via the Q&A tab at the bottom of your window. Questions shall be addressed by presenters on the Q&A tab. For PSK members, if not already done so, please subscribe on the PPP portal for this meeting. It's already there, I confirm that. Go get the page. For KPA members, we also be awarding you the CPD points henceforth. A point to note is that this meeting is being recorded and will be made available on PSK's YouTube page. So to the main agenda for the day is first and foremost the welcoming and opening remarks. Then we will go to the main topic of the day. So just before we begin, I do wish to welcome Dr. Nkatha Kitonga. Dr. Nkatha Kitonga, good evening. Are you with us, Daktari?
Yes, I am. Thank you, Dr.
Karibu sana, Daktari. I do wish to welcome you to give the opening remarks from USAID MTAPS program.
Thank you very much. I'll just request Eric to put up the slides. So thank you again, PSK team and Dr. Gitao for allowing USAID MTAPS to present on this important topic. We'll be presenting on the role of pharmacists in the wake of emerging and re-emerging infections, as stated. USAID MTAPS is abbreviated. The abbreviation is Medicines, Technology, and Pharmaceutical Services Program. So the goal of the program is to enable low and middle income countries to strengthen their pharmaceutical systems, to ensure sustainable access and appropriate use of safe, effective, quality assured, and affordable essential medicines and medicine-related pharmaceutical services. And its purpose is really pharmaceutical system strengthening to improve health system performance with the USAID goals, which is preventing child and maternal deaths, controlling HIV/AIDS epidemic, and combating infectious disease threats, as well as expanding essential health coverage. So just an overview on what we do and what the objectives are. We look at governance strengthening, including regulatory systems, institutional and human resource capacity increasing, and information provision to make decisions in terms of policy and direction for the country. We also support financing to be optimized, including actually provision of resources and the use of that. And also pharmaceutical services in general, we look at ensuring that those are improved. So if I could just dissect the program's objectives in terms of our areas of focus. So we look at multisectoral coordination on antimicrobial resistance. So that's working closely in collaboration with the National Antimicrobial Stewardship Interagency Committee for capacity, to build capacity for coordination for policy direction and monitoring and evaluation of the National Antimicrobial Resistance Plan. And because in Kenya, we have a devolved government, we also support the establishment of the same governance structures within the county level, which are the CASICs. Our other stream is infection prevention and control, and that looks from national all the way down to facility level. So we look at strengthening governance structures for IPC at all levels and providing technical assistance to both the counties, the national level and facility level in relation to infection prevention and control, occupational safety and health, and WASH, which is water, sanitation, hygiene activities. Part of that is also supporting the CPDs. That's what brings us here today in terms of supporting IPC training. The same is mimicked with antimicrobial stewardship in terms of the same level of activities are supported by the MTABS program. So that's what brings us here today, is supporting building capacity within our professions in relation to infection prevention and control. And overall aim is obviously strengthening antimicrobial stewardship in the effort to combat antimicrobial resistance. So I believe this will bring me into the meat of the presentation. So we'll be going through infection prevention and control, give an overview on what infection and prevention and control is, why it's important, and also just link it into what the pharmacist's role is in terms of infection and prevention and control and combating or preventing the spread of infectious diseases. So I would like to introduce the speaker for this call, my colleague, Eric Kitangala, who will take us through the slides. And we hope that this will be an interactive session. So please, in the chat box, if anything comes up, kindly write it in the chat box so that we can have a lively discussion around this topic towards the end of this session. So I welcome you to this presentation. Over to you, Eric.
Thank you very much, Dr. Nkada, for this and for the overview on MTABS, and thank you PSK members, thank you Dr. Gitao for being able to organize this very important meeting. Yeah, so we are here just to talk about these things that are going to affect us, or we are already getting affected by them, keeping in mind that we are having quite a number of emerging and re-emerging infections around us. And we just want to go through this presentation to see what is our role. Pharmacists, what is your role? Where are you placed when it comes to issues of emerging and re-emerging infectious diseases? And even at your facility, as you just your daily chores, you know, what can we do to make sure that we are not conduits to infectious diseases and we are not promoting the spread itself. But as pharmacists, we are going to come in and make sure that we are the ones who are going to stop the spread of such infections. So as I go through the presentation, you will actually see how the role of the pharmacist, either at community level or at a hospital, comes in very handy, even in the industries during production of medicines and all that. What is our role as pharmacists when it comes to this one? So I'll just give a short introduction on some of the emerging and re-emerging infections. As you can see, the UN report that, even from the 70s, about 40 infectious diseases have been discovered. And these ones are new infectious diseases. So if you actually try to break it down, you're going to see that probably in like 1.5 years, there's an outbreak of a new infections. There's a new infection, there's a pandemic. And some of them are like SARS, MERS, Ebola, chikungunya, the avian flu. We had swine flu in 2012. Zika virus just came up in around the 2016, 2015. We had HIV infections in the 80s and the 90s. And then we have the SARS, E. coli, has mutated and there was an outbreak. We have the hantavirus, dengue fever, West Nile virus, again, and COVID-19 that just came up the other day. And that is a thing that we've been battling. And I'm sure even up to now, as pharmacists, being the first line of defense, as I can say, I'm sure the ones who are practicing either at the community level, you'll see the number of people who are coming in with coughs, headaches, malaise. Actually, you are better placed to be able even to describe all that. And then most recently, we've had the monkeypox coming up. So we just want to dissect some of these emerging and re-emerging infections and how they affect the healthcare fraternity, the healthcare landscape, and what can be our role in trying to mitigate and also participate in making sure that some of these infections are not spread beyond where they are. If you look at the global map and the regions and types of infections that are coming up, you could see that it's not only like either a Kenyan or an African affair, it's actually a global affair when it comes to re-emerging infections. And in our region, you can see that we are just surrounded by outbreaks of, Ebola in the West. We have the Marburg, we have the Lassa virus in the north, Onyong in the east, chikungunya, Rift Valley fever, just here with us, actually within the country, and MDR-TB that is actually a big problem. If just a few years ago, and you could see even some of the movies that were being shown. And for the ones who like to watch movies, you could see like World War Z and the virus. Some of these things are things that have been anticipated. Some of the countries have prepared themselves. But you could see even during the outbreak of COVID, most of the countries, including our own country, we were caught off guard. Now, let us just come home. It's like, if you look at on the right, the BBC News Africa. This one was news for the day before yesterday. 3 people have died and 13 have been infected by an unknown illness in Tanzania. The symptoms reported range from fever, headache, fatigue, nose bleeding and all that. The big question that comes to play is, when somebody becomes sick, the initial signs and symptoms, where do they go to first? Do they go to a level 5 hospital? Do they go to a level 4 hospital, a clinic, or the first contact when somebody has a headache is the pharmacy? So you can see already, you know, just bringing home the message that we are not out of the woods yet. And if you look at the pharmacy practice, it is the one that actually comes into play when there is actually an outbreak within a community, because that is the first place somebody will go. When people have headaches, they don't go to the hospital. A child has a fever in the house, you know, the mother will run to the pharmacy very fast, buy something, and then come back to the house and be able to manage the condition. So the pharmacy is actually our first route of help. So the pharmacist becomes a very, very important healthcare worker when it comes to issues of emerging and re-emerging infections. Number one, being able to identify. Number two, even looking at even the trend, like even right now, you could actually tell what is the trend when it comes to issues of people visiting the pharmacy with actually a cold, a headache, and all that. And then coming back home to, you know, what has been disturbing us, COVID. And if you look at the changes, this is some of the statistics that were available on the web that I just picked, and you could see the way the variants have been changing. And as the variants change, signs and symptoms, management, presentation, you see, also changes with it. Delta virus was here with us, and it was quite virulent in signs and symptoms, in spread and all that. Then came in the Omicron, the B1, and then now Omicron B2 that is more milder, but still people are coming in with the infections, you know, going to pharmacies. And even if I ask you, you know, the number of antibiotics, you know, antipyretics that have been sold within the last few years, you'll see that there's a spike. And you look at the complaints, again, these are complaints that are very reminiscent to actually COVID infection. So let us go to pandemics. We just want to just have an overview of what are the risks that we are having currently when it comes to pandemics. At one time, a scholar said that the only thing that can clear the whole Earth are actually just two. There are two things that can clear the whole Earth within a very short time. One is a nuclear disaster, and number two is a viral infection. And you saw it like when COVID actually came up. A viral infection, of course, can clear people within the shortest time possible. So we are going to look at what preventive and how prepared are we to be able to engage and see that when pandemics come, we are ready as pharmacists to be able to stand up to the day and support and be able to make sure that we are not the ones who are encouraging the spread, but we are the ones who are going to limit the spread and make sure that some of these elements don't go beyond and, you know, the spreads are actually curtailed. So pandemics appear to be increasing in frequency. If you look at the years, you know, going down history lane, as you're coming up, pandemics are actually increasing in frequency. Number two, there is an increase in emergence of viral diseases, especially from animals. You know, I think it's because of the interaction with animals. Well, I will not be able to say conclusively, but it is there. Then the risk is driven by combined effects of spark and spread. Where are they appearing fast? And how easily are they spreading into the community? And then geographical regions with high spark and spread are particularly in Africa and third world country. So Kenya, we are not left out. That is where we are. So in case of a pandemic, we are actually laying in the zone whereby the spark and spread can actually be very easy, and the spread of the disease can actually go across a whole region. And then, for example, influenza is the most likely pathogen to cause a severe pandemic. And if you look at the recent literature, is that actually around 6 million people report to have severe influenza annually. You know, severe influenza annually, 6 million. So these are things that as pharmacists, we really want to start appreciating, because anytime there's an infection, then we are the first line of defense. And that is where people will come in and seek for the original or the primary advice. So what is the impact? So overall impact, all these pandemics will cause significant and widespread increase in morbidity and mortality. And a good example is like COVID and Ebola. And then they have a higher mortality rate where, in countries that have low and middle income countries, which Kenya lies in between. And then they cause economic damage through multiple channels. People are unable to go to work. People are unable to go to, just do their normal chores. And that one greatly affects the economic landscape of a country and the global landscape as well. Then they cause negative shocks to the economy and growth. During pandemics, people will stay at home. Nobody's going to work. There's significant social and economic disruption. You could see even things that we've never thought about, and actually, like even just family issues, that were brought up with the pandemic. So there's increase in political stress and tension. Of course, when such things happen, and for the ones who like movies, again, you could just go back and look at the World War Z and how there was political tension and anarchy, when there was a widespread outbreak of a virus. But that one is just a movie. But again, in reality, these are things that are happening. So this is the global risk landscape for 2021. So I'm going to go through the 2021 and also explain about the global risk landscape of 2022. So if we look at the top global risks, by likelihood, actually infectious diseases are the fourth. After extreme weather, climate action failure, human and environment damage, the next one is actually an infectious disease. Now going down and looking at global risk by impact, what is going to impact the global fraternity? Actually, infectious diseases are number one. That include emerging and re-emerging infections. So infectious diseases, viruses, bacteria, that can infect humans, then they are actually by impact, infectious diseases are number one. Meaning, if there's an outbreak today, then the impact of that outbreak will be so devastating to the global economy, lifestyle, and so many other things around the globe. So let us look at some of the health-seeking behaviors in the communities. These are studies that have been done, and we just took a bit of them just to share and see where people actually seek treatment whenever there's a sick person, either in the community, in the house, in the homes. Where will people go first? So if you look at health-seeking behaviors when it comes to access to care of pneumonia, sepsis, meningitis, and malaria in rural Gambia, you can see the spike whereby many people would go to the pharmacy, followed by seeking help from the relatives. So you will either seek help from the relatives or go to the pharmacy. The hospital, private clinics, level 1, level 2, level 3, and whatever will come in later. So you see the pharmacist now becomes a key player when it comes to being the first person to get in touch or in contact whenever there's an infection. If you look at the next table, on the right, the upper one, distribution of adolescent girls by their treatment-seeking behavior. Look at the percentage. Who went to the pharmacy? Attendant, 61.7%. And these ones, we are talking about the adolescents. So 61%. Self-treatment, mother, qualified doctor, homeopathy, all those. even put together are not even half of the people who would actually, the girls who would actually go and seek treatment from a pharmacy attendant. Then down there, this one is another research that was done by an author, Amache, and you could see where would you likely go to seek treatment. And you could see actually over 50% went to the pharmacy. They would rather go to the pharmacy. They will not go to the hospital because they're thinking that, you know, there's going to be judgment from the healthcare workers. They're saying in the hospitals, the cost is expensive. There's issues of shame, distance from the facility. And you could see, count the number of pharmacies around our estates and hospitals. Of course, the pharmacies are higher than the hospital. So the distance to the pharmacy, again, is nearer than the distance to the hospital. And then the disease was not so serious. Yeah, you think about it, anybody who's having a headache, you know, a fever, will first of all go to the pharmacy. And then, you know, things like drugs for STI not available, feeling guilty, advice not to seek care, you know, and others who sought treatment elsewhere. So you see, in all these things, the pharmacist actually is prominent when it comes to the community actually seeking healthcare and all that. So why are we saying all these? You know, why all this emphasis about the pharmacist, you know, about this person that runs the chemist, you know, within our community? Number one, he has become the primary level care. Anytime there's a problem in the house, there's a sickness, somebody would rather go to the pharmacy first, even before thinking of going to the hospital. And then what are the things? Nowadays, you know, in pharmacy, the, you know, primary responsibility is actually to dispense. And then, you know, at the pharmacy, we go there for consultation, you know. At the pharmacy, that is where we'll have better communication because it's a one-on-one. And you always know that if I go to this pharmacy, I'll get a particular doctor. And even if I go tomorrow or the other day, I'll still get the same person, probably over the counter, and we can talk. And look at nowadays, we're actually evolving. Actually, at pharmacies, vaccinations are being done. And you can actually attest to that, either just the normal vaccine and even FP. You know, there are pharmacies that, you know, will also do that within the community. So the other thing that comes into play so handy, why the pharmacist, when it comes to issues of research and drug development, again, the pharmacist is quite handy, comes in quite handy in that. And then therapeutic expertise, where is it found? You know, at the pharmacist. And then there are other services also that are being done nowadays. You know, you'll find blood testing, especially the you know, rapid diagnostic tests will be done there. Health checks will be done at the pharmacies, and that is why people will, not even struggle to go to hospitals. And then you see, our pharmacies have actually evolved. There's a lot of money transactions, mobile money transactions. You'll find whenever there's a pharmacy, there's an M-Pesa. The other day, I was actually looking for an M-Pesa in a mall just here at Kilimani. And one of the persons I asked, he told me, kuna pharmacy pale juu enda uangalie. You know, it's because, you know, whenever there's a pharmacy, we would always think there's an M-Pesa transaction. So why all of this? Why are we bringing up all this? The pharmacist, a trained medical profession, has a lot of contact with the public, which is very, very important. Anytime we need to pass a message, we can pass it so well within the pharmaceutical profession because the contact with the public is quite high. At no one time, you'll find somebody going to look for a nurse in a clinic to be able to get that information. The pharmacist is within the community. The pharmacist is just a stone throw away from where I stay. I can actually rush at night. I can actually rush anytime within the day When I'm doing my mobile transaction, he's going to be there. You see, so if there's any message when it comes to infection prevention and control in line with emerging and re-emerging infections, then the pharmacist has become a very key player. And that is why today we are coming up with this presentation. What is my role as a pharmacist when it comes to pandemics? What is my role as a pharmacist when it comes to issues of infectious diseases, emerging and re-emerging infections? So, if you look at this, this is a big question. Is the pharmacy practice part of infection prevention and control? Somebody will say no, we'll think about that. And another one will say yes. Primarily, what we are doing is dispensing, but there's an evolution. You know, look at this. These ones are tests that can be done at any point. And one of the easiest place to have is a pharmacist, because that is where you're having healthcare professionals. So just a little bit of infection prevention and control. We want to see our roles as pharmacists. You know, what are we looking at? Infection prevention and control, set of practices, evidence-based approach, which prevents patients and healthcare workers from being harmed by avoidable infections and as a result of antimicrobial resistance. Then I just went to check on one of the descriptions of a clinical pharmacist and look at one of the issues. The one in red is actually disease prevention. Apart from being a health science or a discipline that pharmacists provide to patient care that optimizes medication therapy and promotes health and wellness, there is also disease prevention. So just let's look at, you know, healthcare associated infections. Which ones are these ones? By the way, a pharmacist can be a conduit for healthcare associated infections, because what do we handle? We will handle the prescriptions. We will handle the drugs that we are actually dispensing. So if we are infected, we are going to pass the same infection to the client. Again, you know, in the community pharmacy, we will have to pay. Those ones who can pay via mobile money, that's fine, but they're the ones who pay cash. Then we look at what are the practices that can actually stop healthcare-associated infections from going into the community. So this is just a little bit of history, you know, from some of pioneers of infection prevention and control. Ignace, who introduced, you know, hand washing, you know, there was Florence Nightingale, you know, sanitary conditions in the hospital. Then we came to Louis Pasteur, who provided evidence in germ theory of disease, and, you know, founder of modern microbiology, Robert Koch. So all these were in the 18s. So where are we as current pharmacists? You know, what are we looking at? Where are we when it comes to issues of hospital-acquired, healthcare-acquired infections, infection prevention and control as a whole? So that is what we are going to be looking at today. The time is ticking. Pandemics are increasing in frequency. So we want to know, where are we going? So this one was a review that was done, and these ones are actually healthcare workers. And you could see hand hygiene only at 3%, meaning we are actually simply not washing hands. And we'll go to the chain of infection and see what amount of infectious diseases or infections can actually be handled when it comes to hand hygiene. Then the other thing that we are also going to look into is the issues of injection safety and waste management, because there's a lot of waste that is being generated nowadays in pharmacies. Not only drug waste, we are having used gloves, we are having gauzes, we are having blood, we are having, you know, RDTs, you know, that are being produced within a pharmacy. So how can we handle and make sure that we stop the infections within the community, so that now we are not conduits to infectious diseases, but we are also supporting and preventing them. So healthcare-associated infections, of course, they are a burden, a lot of it globally. And actually, we can't say that we know the amount of the burden of healthcare infections within the country. And as pharmacists, what is our role? And that is what we are going to be looking at. So number one, there's a high cost of hospital-acquired infections. You can imagine if somebody got an acquired infection in the hospital and it's supposed to be treated, you know, how much they are going to use, the amount of money that are going to be used to be able to manage some of these infections, a lot of money to be able to manage them. So these are the direct cost to the hospitals and also the direct cost to the patient, because patient and families will lose a lot of money. You see, like just say even a cesarean section that is infected, instead of the patient going home after 2 days, the patient will stay in the hospital 7 days. So you can imagine the burden, number one, to the hospital facility, and then number two, to the patients when it comes to payment for the cost. So as pharmacists, what is our role? We start looking behind. Are we able to discharge? Are we able to move with information and make sure that the communities know the burden of healthcare acquired infections? And then as pharmacists, we are also coming in to be able to support that. So this one is the normal chain of infection that we all talk about, that we all learned in school, whereby we have an infectious agent, you know, that goes into a reservoir, and then it must have a portal of exit. When we talk of COVID, you know, the issues of the mucous membrane, the mouth, the nose, you know, and then means of transmission from one person to another one, you know, the issues of hand hygiene, droplet infection, portal of entry into the other person, again, the mucous membrane. And then we'll talk about issues of susceptible hosts. And then what are these pathogens that we are looking at? Like the ones we've talked of, you know, what are we looking at? So number one, when it comes to infectious diseases, again, or an infectious agent, actually hand hygiene becomes the basis of stopping infectious diseases. And if you look at the practices that we have in pharmacies, handling money, handling drugs, you know, handling clients, you know, testings that are being done, how many times are we performing hand hygiene? Because we are the ones handling that prescription that is coming from a coughing patient. We are the ones handling that prescription that is coming from that patient with an infectious disease. She's walked with that prescription from one place to another one, from one hospital to another one, from one department to another one with the hands. And then that is a prescription that you're given. And then you will handle medication and still give to the client. So how many times do we perform hand hygiene? As pharmacists, that is a big question now we should be asking ourselves. Do I perform hand hygiene after handling every prescription? Big question. Do I perform hand hygiene after handling money and giving change to a client who has bought medicine from my clinic, or I will continue and probably wash after 10 or 20 or 30 patients? Or is it after every patient? Because that is the thing, it's supposed to be after every patient. So that is a big question that we should ask ourselves as pharmacists. What are we doing to be able to break this chain? And you can see that the chain can be broken actually at 80% of the places. And we say that a simple hand hygiene practice can stop 80% of infections. So we look at what are the precautions that we need to take, mostly within our pharmacies. Standard precautions, you know, practices used in all of care of patients at all times. If you're prescribing, if you're dispensing, even when you're guiding, when you're handling the patient, when you're handling the medicine, you must handle them using standard precautions. And then we will also go to additional precautions because, again, with the kind of infections that we are having, of course, additional precautions come into play. So hand hygiene, I've talked about hand hygiene so much. And the other thing that I've actually witnessed with one of our community pharmacy, where actually so many practices happen. You know, there's dressing that is happening. There's actually tests for blood sugar, BP check, you know, and many other, you know, basic tests that can be done. So what are we doing when it comes to personal protective equipment? Are we using appropriately our gloves? Are we gowning appropriately as pharmacists? Because now we've gone beyond just dispensing and we are doing many other practices within the pharmacy. Then issue of management of healthcare waste and safe handling of sharps. So many sharps are being handled within our pharmacies and our chemists. And then there is the issue of cleaning and disinfection and sterilization, reprocessing of medical devices, environmental cleaning of the pharmacy, linen and laundry management. The linen that is in the pharmacy nowadays, how is it managed? Are my people trained, the ones that have employed within the pharmacy? And I know sometimes, as much as there are trained personnel, there are others who are not trained, probably the ones who handle money, the ones who handle mobile money transfers. What training do they have? So that, because when they are working within the pharmacy, they need that training. And then respiratory hygiene and cough etiquette. When patients come, do we have cough etiquette, IEC materials that tell them when you're coughing, kindly do this, put on your mask, make sure you come into my pharmacy, into my chemist with a mask. Without a mask, you're not going to be attended into. So I don't know how many people are walking into pharmacies in and out. By the way, some of them look like supermarkets where you can walk and even pick a few things on your own, then go and pay. But are they wearing masks? Those precautions need to be overemphasized. So yes, I've talked about additional precautions and personal protective equipment when it comes to issues of handling the patients, within the pharmacy environment. Is it adequate? Are we providing, adequate personal protective equipment and all that? So what are the benefits of adopting IPC guidelines and policy? Of course, you're going to give quality of health that is improved, that is better. Hospitals and pharmacies will be less crowded because not many people will be coming to seek help and to buy medicines because their ailments have been, managed. And then there's reduced risk of healthcare workers acquiring infections. You are the pharmacists. Some of them are very small and people come in and crowd. Do you tell them kindly stand out and only a few people to come into the pharmacy, or our pharmacies are crowded? Then there's low cost of healthcare, because when you manage your patients well, of course, there's going to be low cost of healthcare. And then facilities attain good publicity. If your pharmacy people are not crowding, of course, you will get more people coming in because they will see that you are adhering to the guidelines. And then, of course, you will stop the spread of antimicrobial resistance because less and less people will use antibiotics. So this program, as I come to the tail end of my presentation, so what are we looking at? IPC program. It is a requirement for every healthcare institution, including pharmacies, to have an IPC program. It includes surveillance and practice activities. At your pharmacy, how many people have come complaining of a certain ailment, signs and symptoms that, are reminiscent with an outbreak of an infection. So again, IPC program will influence practice for safe patient care outcomes. It engages infection prevention and control professionals. In a pharmacy, by the way, especially the big ones and the ones that have so many activities, we would actually recommend that you have one person who just does, as much as he does the other work, and also engages in infection prevention and control, probably even trainings and updates giving to others who are working within, so that now we can prevent ourselves from getting infections, even as healthcare workers. And then it is managed by a committee, especially when it comes to a bigger institution, not just one person, but for smaller institutions or, an institution with few people, you can just have a focal person. And then it includes everyday activities coordinated by an IPC focal person. And then the following functions are there: manage critical data, recommend policies and procedures, interpret transmission of infectious diseases, and educate healthcare workers on infection prevention and control. At one place, I actually went and asked them, since COVID came, how many of you have undergone the training for COVID-19 infection? And in that pharmacy, actually, they told me none of them had actually been trained. So you can see. And the number of people who are being seen in that pharmacy were quite many, but none of them had actually gone for a training on infection prevention and control regarding COVID-19. So some common IPC challenges in pharmacy: poor hand hygiene practices. You will handle this prescription, handle the other one, give change, and not even perform hand hygiene, or perform hand hygiene after several procedures. That one is actually a problem. Running tap water. How many of us have running tap water within a pharmacy where actually healthcare workers can wash their hands, and even clients who come in when you're dispensing medicines and giving them, whether it is a dot, you want them to take the medicine there. Is there a provision where they can wash hands? Or is there a provision whereby they can use even alcohol-based hand rubs? And then poor waste management. The 3B process of infectious, non-infectious, and sharps waste is in being practiced in pharmacies. Adequate ventilation in some facilities. Some of our pharmacies are very small and you have a crowd of people within. So is it appropriate for people to be standing in waiting for drugs to be dispensed? Poor use of PPE. Patient handling inconsistent with IPC practices, handling several people without performing hand hygiene. Then inadequate information and resources on IPC, like that pharmacy I'm talking about, none of them had actually been trained on COVID-19 IPC. And we are going to now 3 years after COVID-19 actually broke. So pharmacists, what is our role in disaster management? Prevention, preparedness, and response, and recovery. Very, very important for pharmacists. To be able to prevent disasters, be prepared. Are we prepared to handle even the emerging and re-emerging infections? Do we respond positively? Do we report when we see there's a consistent complaint within our pharmacies? I've had 50 people today coming in with a cough. Do we report of that? And then also issues on recovering now from the pandemic. So what is my role as a pharmacist? Number one, practice hand hygiene. After every activity, hand hygiene must be practiced. All our premises must have running water and hand hygiene commodities. We must adhere still to COVID-19 guidelines. And those of you who are actually dispensing and consulting and offering clinical advice, you will actually agree with me that so many people are actually coming up with influenza, coughs, fevers and all that. Waste management and segregation. All the ones who are handling sharps must have safety boxes, and then an accredited person must come and collect that waste. Do not give it out to the people collecting waste that is from houses and just domestic waste, because they'll go and dump it to a place whereby infections can actually spread within the community. Injection waste, again, from vaccinations, family planning, and rapid diagnostic tests must be handled appropriately in safety boxes. And then behaviors, education to the public and peers. Educate the public when they come, because they will come to you for advice. They will come to you for guidance as a pharmacist, because they will know daktari wangu ni huyu, and they will come to you for that. And we know even in the community, there are people who know huyu ni daktari wangu kwa ile pharmacy. Then detection, management, and reporting of communicable diseases, soiled waste management, dressings, gloves. You see, those ones are now being found in pharmacies. Do we have the bins to be able to manage that? Adequate ventilation and space. We have moved from a place whereby a pharmacy was just a corridor. No, a pharmacy is a place whereby you're going to handle patients, advise them. You see, the pharmacies that we used to bend and enter into the chemist, I think that one is now long gone. You need adequate space, because that is where you'll be actually advising and consulting with patients. And then patient safety and quality of care, very, very important. Occupational health and safety for your workers, the barriers, the screens, water, drinking water, and water for hand hygiene. And then cleaning and personal protective equipment, very important nowadays in pharmacies because of these emerging and re-emerging diseases. And you've seen that we are the first line for actually advice and consulting when it comes to such diseases. And then resources, guidance, source for training and reference materials. Have you trained the people working within your pharmacy, whether they are healthcare workers or non-healthcare workers. All of them must be trained on infection prevention and control and be made aware that emerging and re-emerging diseases are actually here with us. So what are the key points that we are going to take home today? Number one, healthcare acquired infections are here with us. And we must be able to manage them, including managing them at the pharmacies, because they have a direct and indirect cost for healthcare provision to clients and communities. IPC has a long history, and we have the basis that have already been laid for us. We need to continue with IPC even as we continue handling patients. And then there are many benefits for adhering into IPC practices, including reducing risks of spread of infections, even among healthcare workers. You remember when COVID was here with us, there was the tea room phenomena, whereby we were going into the tea room, you remove your mask, you start talking, and then one healthcare worker infects the entire staffing at a facility. Then IPC practices are aimed at breaking different links in the chain of infection. Hand hygiene, number one, let us just wash our hands. When we are in the pharmacy, when we are dispensing, when we are handling the prescriptions, handling the money, let us perform hand hygiene after every activity. And then pharmacies are potential facilities for propagating hospital-acquired infections because of the number of people who come in and how we treat them. And pharmacies are strategically placed in promoting IPC and combating AMR. At the pharmacy, you talk to your clients when they come in. That is the best time to give them information on infection prevention and control, and give them also information on how they can stop even the use or rather misuse of antimicrobials, just to be able to make sure that we don't promote AMR. And then there is a national governance structure for promoting IPC in Kenya, and actually even in the checklist for pharmacists, actually from PPB, there's a section on IPC. So we really need to start becoming very keen when it comes to issues on IPC. So I would actually recommend that all pharmacies, chemists around to have the following policies. Kindly go to the website and download these documents. They are really going to be key in guiding you, because in one CME, we cannot talk about everything. Number one is the policy on occupational safety and health guidelines for the health sector. Number two is the National Injection Safety Policy for Healthcare Services in Kenya. Number three, the Kenya National Infection Prevention and Control Policy for Healthcare Services in the country. And then we are actually soon launching the National Action Plan for Patient and Health Worker Safety and Quality of Care. Actually, tomorrow we are going to have a big meeting at Radisson Blu just to be able to go through this document and just for validation. Soon it's going to be launched, and I'm recommending that pharmacies and people dealing with patients actually have it. Then we have a short brochure that can actually be very, very important for people working in chemists and pharmacies. It's a quick check, you know, the infection prevention and control in healthcare settings leaflet that you can actually use, you and the people within your premises. So that is it for today. I'm hoping that we have learned something. We are living with emerging and re-emerging infections, and there's very little we can do about it. In the last 50 years or 52 years, in that case, you can see over 40 new diseases have come up. And then the new ones, you could see that the frequency is actually higher than it was 20 years ago, than it was 30 years ago. So we are actually glaring and looking into another outbreak soon and very soon. I am hoping that we've learned from COVID, and we are going to be prepared not to propagate infections, but as pharmacists to be the people who are going to stand in the place and be able to promote infection prevention and control. So at that particular point, I will pause and take the meeting back to Dr. Nkada, who's going to actually guide in the Q&A and an open discussion. Thank you very much, and back to Dr. Nkada.
Thank you for that. Dr. Gitao, I think, can lead the Q&A. Thank you.
Okay. Thank you so very much, Bwana Kitangala, for taking us through that. As such insightful, knowing that that shows the 61%. I was much interested in the 61%, which shows that the community pharmacist is trusted by the community. That means that we are the number one center for ensuring that we are able to provide adequate healthcare to the community. So, ladies and gentlemen, without further much ado, let us go to the Q&A section. I see a question from Dr. Soreja Goral, who is asking, is it too late to get a flu jab now to prevent influenza and parainfluenza? Dr. Nkada, are you able to respond to that?
Yes, I'll briefly just touch on that. So I know we're in influenza period, and normally countries are encouraged to vaccinate prior to the season when influenza is prevalent in your country. However, it's not too late to vaccinate for influenza. It actually just takes between 10 to 14 days following vaccination to before an immune response and protection develops. So again, as I've mentioned, there are most countries that actually start immunization prior to, but for your risk groups, the benefit will still be there. However, precautions need to be in place for the period when an immune response is not present. That's the 10 to 14 days.
Thank you so very much for your response, Dr. So, as first and foremost, members, I'll request you to post your questions on the Q&A tab. I'm seeing good, nice and wonderful words from our listeners. Dr. Joyce, what you say is a wonderful presentation. So a quick question on that. The members who are seated with me here and are listening as we go through this presentation. To Eric Kitangala, is it the right time for us now to introduce the point of care devices? And are there point of care devices that will guide in terms of infection prevention control at the community pharmacy? Over to you, Eric.
Thank you, Dr. Gitao, for that. So your question, you actually want to know whether we should introduce point of care. Just repeat the questions again.
Do we have point of care devices to assist us in prevention of infection prevention control, or is it the right time that we now introduce them?
Okay, yeah, they're actually there, and they can be used because now that one will avoid the reuse. And most of the time we don't encourage reuse of devices, so that you just use them once and you discard them. Yes, so it is the right time to make sure that now we advocate for them to be used at pharmacies. And also for the ones that don't have, we have guidelines that can guide on how even the others can be reused, disinfected, and even sterilized. So the guidelines are there and we are able to share with the team. Back to you, Dr. Gitao.
Thank you so very much on your response, Eric. I can see another question by Pauline Mwandembe. Can a community pharmacy have a couch? I'm trying to understand the question. Have you understood it, Dr. Nkanda or Eric?
Okay, I'll try to answer this one, and then I will allow also Dr. Nkanda to weigh in. Of course, now that one, it depends with the services that are being offered at a community pharmacy. Yes, and you could see that up there in the presentation initially, I gave a lot of actually activities that now the pharmacies are actually doing, from, even blood tests, from medical examination, physical examination and all that. So it depends what the community pharmacy is actually doing, the activities that are being undertaken there. And when you decide to have a coach, what is the coach for? It must be either for examination, either for a procedure, and all that. And that is what we are talking about. So long as you decide to have one and you decide to do to have the procedures being done in your pharmacy, then you must adhere to the IPC practices. That one is the baseline. Regardless of what activity you're going to do, kindly adhere to the IPC practices. So I will allow Kada to come in and probably also comment. Thank you.
Thanks for that. Yeah, just to reiterate that we're adequately placed as pharmacists to recommend a lot of things around. We always think of antimicrobial agents for treatment, but here we're talking about prevention. So things around antiseptics and disinfectants, we're not just recommending it to our clients, but we're also recommending it for our premises. So what is our cleaning procedures in our premises? What needs daily cleaning, what needs weekly cleaning, what needs monthly cleaning. So I think that falls in that line when you're doing your audit around your facility in terms of the premise. Beyond looking at, do we have hand hygiene stations? Do we have sanitizers? Do we have liquid soap in place? Do we actually have a cleaning procedure for our premise? Disinfecting regularly used surfaces, floors, but also things like that. So your couches, your chairs, how regularly do we need to disinfect it? What agents do we need to use? So as Erica said, IPC guidelines around cleaning and disinfection of areas that are frequented by patients and other healthcare workers is really important.
Wonderful, Dr. Nkada. So another quick question from Dr. Erica Koima, the Chief Pharmacist at Mbagathi Hospital, is managing waste, how best can we dispose of empty vials in hospitals? Since we are advised if incinerated, it spoils the incinerator. Thank you.
Yes, so yes, empty vials have been a headache in disposing. And within the hospital, what we were encouraging is that let them be separated completely from other waste. And the healthcare waste management officers are able to now either put them in landfills, just organize the way they can be disposed of off-site of the hospital so that they're not disposed of within the hospital. It's been a headache on how to actually manage them, but that is the recommendation, that they are actually segregated and then they are actually used off-site for disposal in landfills and all that. So that one, the public health officer within the hospital will be able to advise, but let them be segregated from the other waste so that now they can be handled separately. There are issues of recycling that most of the facilities and even the country as a whole and the waste management department at the Ministry of Health is actually looking at collaborative efforts between the Ministry of Health and the Ministry of Environment to be able to manage such. Thank you, and over.
Asante, Eric. So a quick one from Christine Gedai. Our community pharmacists supposed to give IV drugs. I have a case of one who used to manage asthmatic patients with aminophylline, but it's sad that we lost the patient due to mismanagement. He developed status at asthmaticus. Dr. Nkada, are you able to elaborate on that response?
Yes, it's a passion point for me, this injectable use of medicines in pharmacies. I think generally we want to promote the services of pharmacy, but we also don't want to take on services that we are not compliant in. So it's very important that if we're doing advanced services in pharmacies, that we have the appropriate accreditations and the appropriate trainings to offer those services. In relation to management of severe cases, even we've seen, IV injections of antimicrobials being given as start doses in pharmacies, and we're disencouraging that, because what we're doing is we're breaking the first barrier of our patient in terms of their defense to infections. So this can't be handled lightly. Erica's just gone through healthcare associated infections, and we don't want to be the cause for a bigger health burden in our country. So One is, are we actually appropriately accredited to offer advanced services? I'll call them advanced services because that's beyond the scope that is usually provided by pharmacists. And if so, are we trained, and is there an accreditation process to ensure that we maintain the knowledge to provide these services? So at a first glance, I would say those are cases that you need to report if seen, so that the relevant regulatory authorities can investigate and see whether these services are beyond the scope of the pharmacy. Thank you, Nova.
Asante, thank you so very much for your great response. Dr. Leah Wanjala asks, is bathing with antimicrobial soap every day safe? Eric?
Oh, okay. The principles of IPC is soap, whether medicated or non-medicated, just works well. You know, so long as it is soap that you're using, it works well. For long-term effects, I may not be able to comment on that. I don't know whether Dr. Nkada, you can comment on the long-term effects of actually using medicated soaps.
I'll just touch on it briefly. When we're talking about antimicrobial resistance, we want to reduce our contact with antimicrobials in general. We know that this issue is now become a One Health issue, or it has always been a One Health issue. So we're ingesting antimicrobials. We are, ingesting it through our foods, our vegetables, through our water, even through, obviously the pharmaceuticals. So one is whether these antibacterial soaps actually contain any agents that can increase your contact with antimicrobial agents, or whether they're just termed as that. So I think always read the box, see what ingredients are actually there. And if not needed, then stick to appropriate hand hygiene practices with normal liquid soap. But always read the label just to check whether you're increasing your contact time with antimicrobial agents that may actually put you at risk to being resistant to those same agents when actually needed. Thank you.
Asante, Dr. Nkada. Thank you so very much for that great response. So we go to the last question. This is by Dr. Beatrice Kamau, the pharmacist in charge at inpatient pharmacy, that is at Mama Lucy Hospital. Are there surveillance and active outbreak detection systems for community pharmacies, which are the first point of care for the majority of people? Are there surveillance and active outbreak detection systems? Dr. Nkada, Dr. and Eric Itangala, probably are you able to join hands and respond to that?
Okay, I may not be able to know that, though it is good for the reports to be made through the national surveillance system that is there through the Ministry of Health, especially when you encounter a condition that needs to be reported. There are those reporting structures through the national surveillance system of the Ministry of Health. But within the pharmacy practice, I think Dr. Nkada can weigh into that. Thank you.
Thanks, Eric. Yeah, just as he's mentioned, there are, from the national level, there's been great initiative to set up surveillance systems around infection detection, but also just general detection, general reporting around common disease states and also consumptions of antimicrobials, etc. So I think every pharmacy should have its own reporting system, because you should already be able to be in the culture of surveillance. So I would say set up your surveillance systems within your pharmacies with guidance from the national government that have the guidelines that he has put up, but there's also extra guidelines around surveillance, even in antimicrobial consumption. but set up your system so that when the national systems are up and running, then you're able to feed in this data appropriately. I don't know if Dr. Gitao has any other input from their point of view in terms of reporting, but that's what I would recommend.
I thank you so very much, Eric, and thank you so very much, Dr. Kata. So probably what is seeming to be a need, the pharmacists may need to be aware and more emphasize there on the issues about how to report on the national surveillance system. That is a point to note that we may probably need to retrain and probably come again and understand on the need to understand the reporting systems.
Yeah, that is noted, Doc. I think that is something that we can look at probably in the next presentation, also touch on how the pharmacists can actually report through the national reporting system. So that one, we will do that. Thank you.
Asante so very much. So probably, Eric, you can give us your parting shot for today.
Yes, so my parting shot for today is that pharmacy practice is quite important, and we can use actually the pharmacist to be the one propagating the information on infection prevention and control, because they get in touch with quite a number of the people in the public. And actually, as a pharmacist, take it up and let's practice infection prevention and control, and also propagate the same message to our peers and also the public. So thank you, and thank you also for listening.
Asante, Bona Eric. Dr. Nkadha?
Thank you, Dr. Gitao, for allowing us to have this presentation. Thank you, the PSK team, for the great work you're doing in just increasing the knowledge and the capacity within the pharmacy profession, even beyond. For me, I just want to say that we as pharmacists, we play a very specialist and important role in combating antimicrobial resistance and also preventing the reemergence and the emergence of infectious diseases. The roles are around IPC and leading actually antimicrobial stewardship. So as a parting shot, I would like to just encourage us to really promote the appropriate and rational use of antimicrobial agents, also advise on health systems and selection and use of antiseptics, disinfectants, and sterilants. So those are our roles, even risk management, treatment, and monitoring our patients. We have the biggest contact with patients and communities. So let's play an active role in really elevating the healthcare agenda in our country. Thank you again for having us from USAID MTABS program. Thanks, Anova.
Asante, Dr. Nkadha. So probably Dr. Dinda Kusu, can you probably hear us on your end? If you can hear us, Dr., you can give us the closing remarks.
Thank you, Dr. Mbao. Can you hear me?
Yes, I can hear you loud and clear, Dr.
Thank you very much, and thank you to the presenters, Eric Kitangala and Dr. Nkadha. Thank you to all the participants for joining. It's been a very enlightening session. From my perspective as a pharmacist, really this is an area that we may not have taken on as our core business, or we may be doing it just without, the conscience that we have a really great role to play. And it's important that we become more proactive, really to prevent infections, to promote patient safety, and also for ourselves to promote, occupational safety and health amongst ourselves and our workers. And then to go further on and also really be cognizant of the importance of managing waste, segregating waste. Some of the things that as we're busy running our pharmacy businesses, we normally don't, take as a priority. There is a loan to apply the knowledge acquired today in our pharmacies and also in our hospitals, whether it's public, private, and faith-based institutions or wherever we are practicing. So I really just want to conclude by thanking PSK for again providing this avenue for us and for others, that we continue to share information and continue to hone our skills again towards continuing professional development. So thank you very much, and back to you, Dr. Bao.
Asante sana, Dr. Dinda Kusu, for the great leadership at USAID MTAPS. Thank you so very much, Dr. Nkadha Gitonga, and also Eric Kitangala. I can see our members wengi wanauliza kwamba CPD points, and I'll quote Dr. Niro, who says that CPD points zimeoga, hazija kunywa maji leo. We're going to be having the CPD points were uploaded, but due to some delays, they're not able to appear on today's portal. We'll be having them on the portal by close of business tomorrow. So please ensure that you subscribe to the meeting, and the CPD points will be sent to you a week from now. That's when we are planning to ensure that we share the CPD points for this wonderful meeting. Kwa kweli sina mengi ila kusema asanteni sana kwa kujiunga na somo letu la leo, kwa kukaa makini muda huu wote, kwa kuweza kusikiza mfunzi wetu wa leo katika somo la leo. Mengi zaidi kutoka somo la leo utalipata katika tovuti yetu ya YouTube. Hadi maswali ambayo yameulizwa utayapata pale. Kuna video ambayo itakuwa pale kuhusu somo letu la leo katika tovuti ya YouTube. Waswahili hawakutupaka maji wala mafuta kwa mgongo wa chupa waliponena lililo na mwanzo lazima liwe na mwisho. Tumefika tamati wa somo letu, na sina budi ila kuwaaga na kuwapa pia shukrani zake rais wa shirika la daktari wa dawa, that is Pharmacist Society of Kenya, Dr. Louis Mashogu, naye CEO wetu Dr. Lucas Nyabero. Sina budi ila kuwaaga, muwe na jioni njema, tupatane wiki ijayo katika somo lijalo la wiki ijayo. Alamsiki.